In this video, we are going to cover how your joints change as you age, common causes of stiff joint, how to protect aging joints. Just to start with, joint pain and stiffness seem to go hand in hand with aging, not just age. Starting around age 30, you begin to lose bone density and muscle mass, both of which can create strain and pain in your joints. Osteoarthritis is osteoarthritis. This type of arthritis, sometimes called wear and tear arthritis, happen when the cartilage that protect the end of your joints wear down. Most people will develop some degree of osteoarthritis. That is what usually causes joint aches and pain as people get older. Number one common cause of stiff joints. More than 32.5 million adults have osteoarthritis-related joint pain, aching, stiffness, or limited mobility, but you can have stiff joint without osteoarthritis. In fact, you can have stiff joints without any clear cause. Blame it on getting older. The connective tissue in your tendons and ligaments gets stiffer as you age. Also, loss of muscle strength as you age can increase pressure on your joints, especially your knees. Ross say the pain you feel is likely the start of osteoarthritis, which commonly start in your 50s and usually affect women more than men. You will want a doctor to check it out instead of only self-treating symptoms at home. That way you can get some personalized advice on how to maximize your joint health. Plus, it is important to know if the pain is caused by something serious like a autoimmune disease. Number two, inflammation, arthritis in older adults. If you are well into middle age of past it, your doctor may consider a handful of conditions that aren't due to mechanical stresses. The pounding, twisting, and pulling our joints endure countless times a day. Other cause of intra-articular pain, which is pain inside the joint as opposed to the tissue around it, can be broadly characterized as inflammatory condition. There are many inflammatory joint conditions, essentially inflammatory arthritis, but they all have one thing in common. An overactive immune system. Unlike osteoarthritis, they aren't usually associated with aging, but some inflammatory conditions do not. But inflammatory conditions do have a big impact on an older population. Pseudogout commonly affect wrist and knee pain in patients above the age of 65. Your doctor may also look at the possibility of elderly onset rheumatoid arthritis or psoriatic arthritis. And another diagnostic that may be considered is polymyalgia rheumatica or PMRI. It is typically causes sore, stiff shoulder and hips, and sometimes systematic features such as fatigue and low fever. Non-arthritis pain. Arthritis is so commonly linked to aging joints that you may not even consider the possibility of another cause. Your doctor will though, which is why it is important to make an appointment instead of self-treating your nagging pain. Have your tailored treatment and checkout. And these are the major causes of joint pain outside of arthritis, and they include joint related injuries, such as strained ligament and tendons. Number 2, bone pain from fractures. Number 3, lack of vitamin D. And number 4, hyperthyroidism as an underactive thyroid glands. And this is how you need to protect and ways to protect aging joint. You may be able to reduce your risk of joint pain and injuries as you age by making smart choices. For example, warm up before exercise and stop if you feel new or worsening pain. It is more challenging to reduce your risk of joint disease, though not impossible. To keep your joints as healthy as possible into your golden years, follow these general tips to reduce pain and maintain function. Number 1, make exercise a top priority. Number 2, keep your weight in a healthy range or ranges. Take steps to prevent injury if you play a sport. Number 4, ask your doctor if you have a certain deficiencies such as vitamin D or estrogen that will make your joints more healthier and perfect as you age. Thank you for watching this video. Consider subscribing and hit that notification bell.